Is this thing still on?
Sounds like they heard us. We are seeing some change.
We need to continue to disrupt the status quo.
And now the work begins.
You are now about to witness the strength of nursing knowledge.
Welcome to the Gritty Nurse Podcast, an unfiltered discussion on health and healthcare. My name is Sarah Fung.
My name is Amie Archibald-Varley, and we are your hosts. Our Toronto Star and the Globe and Mail national best-selling book is available now. Get your copy of The Wisdom of Nurses today. You can get a book for purchase at any of your local retailers like Indigo or Chapters, or pick up your book online through Amazon or other types of retailers. It's also available in various different formats like audiobook and on Kindle. If you read it and you loved it, please leave us a review.
Please make sure you subscribe on our YouTube channel where you can watch our podcast in video format. Like, share, and leave a review. If you're listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, leave us a rating and review. Thank you to all our listeners and sponsors who continue to support us.
Your support makes our podcast possible, and we're grateful for the partnership and for you believing in our work here at the Gritty Nurse Podcast. Stay gritty. Happy Black History Month. Thank you so much for tuning in, listening to the Gritty Nurse Podcast over and over again. We're excited to have you, and we have a hot topic. I think this is so important to talk about, particularly what we're seeing in healthcare related to, racism in Canada, in the States, and, kind of alongside this whole, we're seeing these confirmations of politicians, and particularly, again, because our focus is healthcare, we're talking a little bit about RFK and some of the things that he said in relation to race and healthcare, because, again, we know that there are crippling and devastating effects that can happen when we spread misinformation. So there's a long-standing history related to, racial injustice, inequality in healthcare. And I think it's more than time to talk about it because of all the different things that we've been seeing. And we do see, this misinformation play out in medical training in the way that, we learn about, healthcare and race. And again, just understanding that race is a social construct, not a biological one. And we have to talk about dispelling myths and racist attitudes towards Black women that have persisted through time, through history. And again, we need to have this conversation. So let's get started. Why do you think we should discuss race in healthcare?
Well, I think that it's really important, first of all, to understand, like you said, that race is a social construct. I don't know why I think we have to say this, but there are no genetic differences between a Black person versus a white person versus an Asian person.
Right.
So I think we just need to clarify that we're not talking about apples and oranges. Okay. We're literally for the same,
We're the same fruit.
We're the same species. Okay. So let's just get that clear. First of all, secondly, I think there's been a lot of historical misinformation.
Right.
There's been a lot of distrust. There's been a lot of inaccurate information that people of a certain race have different needs, like we're going to get into it, right? But in terms of even vaccinations, how certain groups have different immune systems, I think this is misinformation. We really need to clarify this. So I think it's important that we talk about it because it's really hard now these days to get accurate information, and we want to be science-based. We want to be evidence-based. That's what healthcare and nursing is. And so it's really important for us right now to kind of talk about this and make sure that we're talking about the right information and using the right language.
Yeah, I mean, this conversation is top of mind, like you had mentioned, Sarah. And again, African Americans have had a long history of mistrust from the medical system, rooted in legacies of abuse and mistreatment and unethical experiments on Black people. So again, the Tuskegee Syphilis studies, back to obstetrics, talking about Mariam Sims. I think we've had episodes talking about the horrors of gynecology and obstetrics related to him. Henrietta Lacks in relation to cancer treatment, which violated all principles of research ethics. And again, we have these all stem from these ideas that are not rooted in reality. Again, that race is somehow biological and causes these various differences that we see. And like Sarah had mentioned, there's evidence from the Human Genome Project that there's no genetic basis for race, and that the term race is not biologically meaningful. And statements like the ones that Kennedy made, and we'll get to it, are categorically false. Again, this is where we just have to continue to break down and dispel these myths. Again, race is a poor proxy for genetic ancestry and large genetic studies. And studies have demonstrated more variation within defined racial groups, so intraracially, than there are between different racial groups, so interracially. So I think that, again, our job as healthcare providers and educators and advocates are to continue to talk about the facts. It's something that RFK does a really bad job of. He doesn't know the facts.
So do you want me to go into kind of like what he was saying recently? Okay.
So why don't we quickly run a clip of what he said at the confirmation hearing?
So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the pollen article suggests that blacks need fewer antigens than.
This is so dangerous.
You get the same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
I mean, do you think science is dangerous, Senator? This is published peer-reviewed studies.
So as you saw in this clip, he's basically saying that he's suggesting that Black individuals possess stronger immune systems than white individuals. I don't know where
they told me this.
I don't know. Okay, where do I lie in all this? Okay, because we're talking about Black people and white people. What about me? Like, where am I in this spectrum here? Because I'd like to know too. He is saying that there are differences in immune systems, but he's also suggesting, based on this, that there be different vaccination schedules based on race. Now, if there isn't anything more dividing this, like, I don't even know what to say. And again, where do I fall? Am I like somewhere in between? Like,
I mean, it's news to me that my immune system would be any different than anyone else's. Again, this is why we have to continue to have these conversations, right? And I think that, he referenced these studies. So let's dig into these references of the studies. So again, he referenced a series of studies showing that particular antigens that Black folks have a stronger reaction. Well, again, it's really great that the people from these studies actually came out and was like, what the fuck, RFK? Like, what are you talking about? So RFK has always been, promoting conspiracy theories, and his claims to kind of earned this reputation of being kind of, known for saying a whole bunch of hocus pocus. I guess that's the best thing. And it's also always related to like vaccinations. So the study's author, Dr. Gregory Poland, told NPR that they found no evidence of increased vaccine side effects, and that his claim of like increased vulnerability among African Americans who receive vaccines is just not supported by the studies that he's reading. And then another part of the study says that he actually just, didn't interpret the results. And this is why it's so important that healthcare providers and experts in the field, like scientists and people who have their PhDs in these areas of research, actually talk about research findings. Because anybody can read a research study, anybody can read the paper, but interpreting the findings, I think, is the most significant part. And the fact of the matter is, he just didn't interpret them correctly.
Right. And I think that sometimes when you take one line or one sentence out of context, it doesn't really, I mean, like, you can find evidence to support whatever it is you're looking for, but if you don't really understand what you're reading, it doesn't make sense. It's the same as if you or I did a media interview and someone pulled out like a short sentence of what we said, but it wasn't the entire context. I think that's the part that's missing here. And it's very dangerous to be making these statements. And I don't know what type of research it was. I don't know who funded it. I don't know if there was adequate controls in place. Like, we don't know anything, right?
Well, I mean, again, like the author of the study that he quoted, referenced at the hearing, was not related to Kennedy. He told NPR that while it's true that immune responses have variations and can be varied by race, sex, and potentially dozens of other factors, the data does not support a change in a vaccine schedule based on race. So it's just like, he read the article and he's like, you know what? I like my interpretation better. And this is what I'm going to say. How dangerous is that? That is like so dangerous that he's just taking the information and is putting his own spin on it.
Well, it's scary. I mean, if you're a Black person and you're hearing this, are you thinking now that, you're not going to get the same vaccine access as someone who's white? Are you going to be told that you should get fewer vaccines because your immune system is quote unquote stronger or has a more robust reaction to vaccinations? Like, this is the thing that's really scary to me. Like, if we're already not divided enough as it is, now we're being told, or Black people are being told, that they don't deserve the same vaccination schedule as everyone else.
Yeah, it's wild. And I mean, again, like, this is where we need to dig into where did all of these type of things stem from? So throughout history, there are two enduring physiological myths. One, that Black folks have higher pain tolerance and we have weaker lungs. Other thing that's false is, these things related to vaccines causing autism and various different things. And unfortunately, some of these things have been taught in medical schools. And when they did a study in 2016, and it revealed that 222 white American medical students and residents, nearly 60% thought that Black people's skins were thicker than white people's. 12% thought Black people's nerve endings were less sensitive, and neither of these things are true. So again, I think this speaks to the next section in which we should talk about, like, what are the harms that can befall? Like, I mean, it is very scary to hear that people still have some of these viewpoints. It's crazy. It makes no sense to me that we know that has no basis, but people are still practicing in this way. And still believe this. 60% of medical students had some of these viewpoints that were rooted in racism. And I can imagine them going out in the world practicing and prescribing medication and saying, well, that Black person, they got thicker skin. So maybe they don't need as much anesthesia, or, they don't need that much pain medication because they can deal with pain better, when all these things are false.
And I think that part of it too is perpetuating biological myths. So the assertion that race correlates with biological differences is misleading. And again, race is a social construct, not a biological determinant. It undermines vaccine confidence, right? So suggesting that vaccine protocols based on race can sow confusion and decrease trust in vaccination programs. And we've already seen that there are certain racialized groups that have lower vaccination rates due to the mistrust in the healthcare system. And I think this is only making it worse. And the third thing is reinforcing health disparities. So information, or I should say misinformation, can divert attention from the real systemic issues, which are contributing to healthcare disparities. And this is really hindering our efforts to, achieving equitable healthcare, which is, I think, one of the main issues.
100%. Like, I think back to, when the pandemic started, and kind of like even thinking about his whole idea behind a difference in vaccine schedules and how the ramifications of that would, show in our communities. Like, one of the first things that we saw was, when we started rolling out COVID-19 vaccines, that those neighborhoods were some of the last neighborhoods to get vaccinations. But again, the hardest hit in terms of seeing the more poor outcomes, more morbidity and mortality related to this. So again, imagine a whole change in the vaccine schedule where, maybe Black people get them last, or they don't get certain vaccines at all. Again, we would see damaging effects to our communities and our populations, where those health inequities would just continue to increase, and that would be devastating. Again, just this whole idea behind this, this incorrect interpretation of health information. I think we are in this disinfodemic where people just feel like, okay, Dr. Google, I can just search it, read it, and then I have the facts. And it's like, that's not how things are working here. And I'm glad that people are trying to be more knowledgeable about the subject, but we have to stick and listen to experts in these fields who understand what they're talking about in their study, particularly how, RFK just got it wrong, and he doubled down. It's like, even the reporter or the person who wrote the research was like, he's not interpreting the studies properly. So again, these are the harms that can befall. And again, I think that we talk about like public health. I couldn't imagine what it would look like if we decided to just say, okay, the things that he's saying about vaccines are true, or he takes this stance where he is confirmed and, gets rid of polio vaccinations or measles, mumps, and rubella. Like, have you seen what I had to Google images recently to be like, what does it look like when someone has polio? And seeing all those pictures of like children in
and they're probably all
lungs.
black and white, right? Because it was so long ago.
White. Like, why we don't want to go back here? I don't understand. And it's just like, just so much fear mongering around things that are just simply untrue. And again, I struggle with this conversation where it's like, are we actually learning from history? Right? We've seen what has happened. We've eradicated smallpox. Do we really, in this lifetime, want to see these things again?
Yeah, this is like, honestly, like when I saw this, I didn't know whether to laugh or cry. And I still don't know. I'm like, my coping is to either laugh or cry. It is so outlandish what is happening right now. And I feel like all of what we're talking about, like when you mentioned that some people think Black people have a higher pain tolerance, I feel like it's always not benefited the groups that need it the most, right? Like up until recently, like babies that were circumcised weren't even given pain medication because it was thought that babies couldn't feel pain. I know that there's a huge issue with women when they present with pain. They're often written off like, oh, it's just your time of the month. Are you really in that much pain? You don't need these pain medications. Like, just people that are vulnerable are never taken seriously. And I feel like this is just an example of that.
Yeah. And again, just kind of looking back at some of like how this rhetoric is dangerous. Again, one of the authors from one of the articles that we read, she noted that even though false claims that Black people possess a stronger immune system or higher pain tolerance persist, the demographic actually suffers from higher maternal morbidity rates and lower life expectancies than other groups. And also, just these types of ideas can also be used to rationalize lack of care of underserved or underrepresented populations. And that would be my fear, right? It's like, okay, so they don't need these vaccinations. What else don't they need?
Right.
What else do these radical racist ideas propel, and what other things can be done in the healthcare system to, reduce us from having healthy outcomes? I think that is very, very concerning. And again, this is where we talk about those various different aspects of the social determinants of health too, right? Just saying, okay, we know that racist policies and practices lead to, those inequities and social disparities. And again, what are we really trying to do here? If we're trying to see a healthy community, we want to see all healthy communities. We want to see all, cultural groups thrive. And I think that targeting and using race this way is obviously the opposite effect. And I can't say enough that, learning and understanding about where we came from or Black history. And I think that, we just don't want to go back there.
Right. And I think it's dangerous to make a blanket statement about any group or perpetuate any stereotype. So saying that Black people have stronger immune systems, I feel like is very damaging. And I don't know how you felt when you heard this statement, but it's like, it was almost like a compliment, but in disguise. It was like saying, oh, well, you have a better immune system. It's like, but number one, no, you don't. And number two, now you're saying we're not deserving of the same healthcare as everyone else.
Or the same treatment, right? So
Right.
That's exactly the problem. Like you mentioned, that the claims are made to seem to be positive, but they calcify the reality that there is a disparate access to health and healthcare, and it has real life implications.
Like literally, yeah.
Yeah. So like, again, as they're spinning it as like, oh, your immune system is better, but that actually would reduce the type of treatment that would be so well deserved for that individual and increase suffering, which again is something that we don't want. I'm glad that they called it out. One of the individuals who were at the confirmation hearing was a Black woman, was just like, so what vaccine schedule do you think I deserve? And again, just calling out how dangerous that rhetoric would actually be. So what do we need to do next? What are the steps that we need to take as healthcare providers, as advocates, as people that work in the system with communities and patients and families? Like, what is it that we can do? And we can ask other people to do to dispel these misconceptions?
I think it's really important to stay informed about the latest evidence-based practices. Make sure you're getting your news from reputable sources that are neutral. And really just understand how to find this accurate information, right? Like, I think that's one thing. And also really building engagement within Black communities. So listening to the Black community thought leaders and advocates, like what are they saying? Listening to their concerns, and as healthcare providers, knowing how to provide culturally competent care and coming from an understanding that, there's been trauma. Like, how do you provide that trauma informed care so that you can really connect with these people and understand where they're coming from? The other thing is, I think what's already happening, right, is the advocacy. So challenging and correcting misinformation when encountered. I think anyone listening that's a healthcare provider, we all have a duty and responsibility to do this, right? And not stick our heads in the sand and not say like, oh, well, no one listens to this person anyway. But the truth is, a lot of people listen to him, right? Obviously,
a lot of people listen.
Otherwise, it wouldn't have made the news. So clearly, there are people that believe this, and we need to be able to use our profession and whatever platform we have to dispel some of this information. And I think the last thing is advocating for policies that address systemic racism and promote health equity.
Yeah, I think I wanted to go back to the whole like finding correct health information. I mean, if anybody's been on social media over the past couple, I would say even just last couple of months, it's been getting more and more challenging to find like accurate health information. Mm-hmm. And even seeing that, for example, like some news organizations are being like falsified. So for example, just recently, my mom sent me an article from the CBC and I was like, what is it that she's sending me? And it looked like the top banner was just like it's like top headline sources.ca. It's meaning it didn't even come directly from, the CBC. And my mom was caught sending misinformation. I'm like, oh no.
So she thought it was the CBC.
She thought it was real.
Oh
and
my
again,
God.
This is where it's getting harder and harder to find where the actual right sources for. So like just even a simple tip, like if you think this news is coming from the CBC, like make sure when you're looking at that headline or the web browser that it says it's from like cbc.ca. Mm-hmm. Or that, if you click on the graphics, does it take you to another CBC article? Like there's certain little things that we can do to make sure that we are looking and making sure that the articles we're looking at are actually, from the sources they say they are. Mm-hmm. And then again, I think like you said, Sarah, we just need to go to the source. So
like go to the CBC website. Yeah, like if you're not sure, go to the CBC website and see, is this article there or was it from somewhere else entirely?
Right. And even if now you're looking for like reproductive information, make sure you're going to like an official like .gov or like an official website that talks about like obstetrics or gynecology or whatever these different things are. Because again, there's so much misinformation. And I understand that the media has done a really shit job. Like they're not doing a good job of, parsing things down. They're like, okay, we want to hear both sides arguments, or we need to do this. Or not even reporting the accuracy of the news. And I think that's another problem. So we need to make sure that we are looking at a variety of different sources, whether they're from independent media or mainstream, but making sure that we fact check. Like it takes 2 seconds to be like, okay, this is the statistic they wrote. Let me put that into to see if what this person is saying is truth. And again, we could have a whole other podcast about veracity and truth, because that's getting harder to have a conversation with. Like I can say the sky is blue on Twitter and I can have 50,000 different people come back to me to tell me it's not. So it's just like,
and the thing is like, it's really scary because if enough people tell you that the sky is not blue, then you start to question yourself, right? And then it's like, am I crazy? Like, is something wrong with my eyes? And that is what can happen. This is a danger of groupthink and being sucked into this. So I think even, taking a step back and talking to your healthcare provider, going onto reputable websites, talk to your healthcare provider. Because I think one of the things I've noticed over the past like 10 years is that everyone's just putting everything into Google now and thinking like they know.
Well, everyone's like experts now,
right? Everyone's better
I'm
than
an expert on the weather now, right? I'm an
expert. Or like I've done my research, meaning I clicked on 2 different websites that may have been questionable.
Or I read the research article myself and misinterpreted. Like, I mean, I'm glad that people are trying to find information, but now it's just getting more and more difficult, and we have to do our due diligence to dig a little bit deeper. And the other piece that I like that you said, Sarah, is particularly for Black folks, knowing that there is this history of mistrust, and it's rooted in the fact that there was real harm that was done. We kind of highlighted some of them at the beginning, is the importance of involving these communities, involving Black folks, involving, and again, Blackness is a diaspora. We are not a monolith. We come from a variety of different backgrounds, but involving and hearing from, Black peoples to find out, it's essentially meeting us where we're at, to find out how can trust be regained. And again, it's nothing about us without us, right? I think that when it comes to healthcare, particularly, and healthcare providers don't do a very good job of this. It's kind of passing the baton, right? Yes, we might have expertise in that particular area of medicine, but how is it that we can take that and hear the validity of someone's experience, to be vulnerable, to say, okay, I might not understand, but this is how we're going to make this work. Because I think that, again, medicine and healthcare, these are things that we're supposed to be working with communities, working with. It's a service, and it's changed. Right? Our job is to make sure that it's not a passive process, that it's an active process, between, the patient and the care provider, and understanding that, repairing and healing takes time. But again, it's something that needs to be done collaboratively. And I think the other piece is, you mentioned it, equity in medicine. We need to just see more racialized folks in medicine. I think that there's more than enough evidence that says, particularly looking at the stats here in Canada, that there aren't enough racialized folks in medicine. There aren't enough Black folks in medicine. And I want to get on to this, and I'm not going to beat a dead horse, but this whole idea behind DEI, people have just turned this into this bastardization and really don't understand what it means, because diversity, equity, inclusion does not mean lowering standards. It does not mean that, because again, at the end of the day, the standard is the same. The person who comes from a racialized background or comes in with a disability, they still have to meet the same testing standards, and there's nothing that changes. But what changes is making it more accessible to folks who would have never thought or never imagined that medicine could be a career for them, or maybe they had a hard point in time in their life where their GPA was bad, but through equitable help and resources, that they were able to pull their GPA. But the standard in terms of what the work that has to be done has not changed. So again, I think it's so important that schools and organizations do look at equity and diversity and inclusion and say, this is something that we do need. And it's not about making it easier, because again, I would hazard to say that there are a lot of folks out there, particularly Black women, that are highly qualified for roles, and we have to work 10 times harder, have to have much more certificates and credentials, and still will get less pay than our counterparts.
Right.
So again, I think it's just dismantling some of the myths, depoliticizing DEI, because it's highly been politicized. I mean, in the States, it's just a fucking mess. Let's just say it's a mess. And understanding that seeing the strength in someone else's experience and lens, whether it's, from a Chinese individual, or it's someone that's Black, or it's someone who has a disability, does not devalue the work that goes into for that person to be in that position, to be a physician, to be, a nurse, to be a CEO. So cut the shit and let's get some more people who have different varied of life experiences to be in medicine.
Right. And going back to what I said about seeking out information from your healthcare provider, I think generally people relate better to people who look like them when
There's
talking
evidence.
about,
Yes.
right. So when talking about challenges or seeking healthcare information, when you know that someone understands you and knows where you come from and is part of your cultural group or whatever, I think it does make a big difference. And so just going back to what you said, Amie, we do need more diversity for many, many different reasons. And also one other thing I want to mention is we are recording this episode in February in honor of Black History Month, but it doesn't mean that when February 28th comes around that we just go, okay,
preach, Sarah.
Okay, we've done our job. We only talk about DEI from February 1st to the 28th or whatever, like the 29th some years, but let's continue this conversation before and after Black History Month, because that's something that I've noticed throughout my career is like, it's like the theme of the month, right? You're like, it's nothing more than a theme.
Next month is Asian month, and it's like, oh, that's all.
But it's just done. It's just like
we're all done.
Like, okay, like February is also Valentine's Day, right? So like we just stopped talking about it because the day's over, but it's not like the challenges.
You don't love anybody after that. You give the flowers, you give the chocolate, and you tell you're supposed to F off. Yeah. No, it doesn't work that. You're 100%.
So let's continue this conversation, and it is a good starting point, but doesn't mean it begins and ends in the month of February.
100%, Sarah. You hit the nail on the head there. That again, these conversations need to continuously happen, and I think that the more we continue to engage our listeners, and the more that we continue to call out the misinformation, say RFK, you that's wrong, that we can make change. And I think that at the end of the day, we want to see healthy communities. We want to see communities, racialized communities thrive. We want to see Black communities thrive. We want to see Asian communities thrive. And we can't do that through medical misinformation. So at the end of the day, we're gonna do this hard work, and we're gonna do this together. So I hope you had a good time listening. If there's anything that we missed, please let us know. Again, happy Black History Month. It's not just about talking about slavery, but also recognizing the great contributions Black folks have made throughout history towards medicine and various other things. And also, like Sarah said, not celebrating it just at the month of February, the shortest month.
Right. And one last plug is, if you like what you're listening to, don't forget to subscribe to our YouTube channel, leave us a review wherever you listen to podcasts, reach out to us and let us know what you thought of this episode and what else you want to hear about.
Absolutely. So thank you. Stay tuned. And thank you for listening to the Greeners Podcast. Happy Black History Month.
Thank you for listening to the Gritty Nurse Podcast. If you have any suggestions or want to hear a specific topic, email us at grittynurses@gmail.com. That's grittynurses@gmail.com.
We are also speakers and authors available for engagements related to advocacy, nursing, mental health, and health policy. Please connect with us.
We want to take a moment to express our deepest gratitude to our incredible sponsors. Their generous support has been instrumental in making our podcast a reality.
Thanks to their belief in our mission, we're able to bring you engaging content and connect with our amazing community. We're truly grateful for your partnership. Thank you.